When we look at chronic health conditions that school districts may encounter, it is important for all staff to be familiar with signs, symptoms, and how to respond to these conditions. Students may have special medical needs, and being familiar with any emergency health plan is critical. At District 44, students with chronic health conditions typically will have an associated care plan, such as a food allergy care plan or diabetes care plan. These plans are in place to help our office staff and those staff members who work with these students throughout the day understand more about the student's chronic health condition, and respond appropriately in the event of an incident. Some of the most common chronic health conditions that impact both students and adults include asthma, food allergies, seizure disorders, and diabetes. A chronic health condition is a long term health issue which may or may not include visible symptoms. In this training, we'll go over some of these common health conditions and recommendations for response. Before speaking specifically to chronic health conditions, we do think it's valuable first to know how to respond to a medical emergency in general. All medical emergencies are unique in nature, and therefore the response to situations may vary. District 44 staff should respond to a medical emergency as follows. First thing you should do is check the immediate vicinity around the sick or injured person to make sure it is safe for you to approach. Examples of danger include, but are not limited to, live electrical wires, gas leaks, building damage, and even animal threats. The next thing you should do is call or notify the health office and provide information on the nature of the injury or illness, the exact location of the sick or injured person, and the physical description and condition of the sick or injured person. After that, do not move an injured person unless a life threatening condition exists in the immediate area. You'll want to protect yourself against contact with bodily fluids to minimize or eliminate exposure to bloodborne pathogens. Upon arrival, health office staff or local emergency responders will take over assisting the individual at the scene. Let's look specifically at asthma. Asthma is very common in the United States, with 1 in 11 children having asthma and 1 in 13 adults having asthma. It is more serious than many think and is the leading cause of school absenteeism due to chronic disease. Asthma is a chronic lung disease that causes inflammation and narrows the airways. Chronic, as we said, means lifelong. It does not go away, and no one can outgrow asthma. Anyone diagnosed with asthma can experience symptoms at any time, so it is important that medication is accessible. Asthma can be controlled and managed with medication and trigger avoidance. An asthma trigger is something that causes someone's asthma to act up. An asthma episode can get worse with each trigger someone comes in contact with, so avoidance of triggers is always best. Not everyone will respond to the same triggers, so it's important to know students' triggers so you can help them avoid them. There are two types of triggers: allergens and irritants. Allergens are substances that cause no problem for the majority of people, but which trigger an allergic reaction in some people. During an allergy attack, the body releases chemicals called mediators. These mediators often trigger asthma. Indoor air allergens such as house dust mites, cockroaches, mold, and animal dander have been identified as principal allergens that trigger asthma symptoms. The other category of asthma triggers is irritants. Irritants such as cigarette smoke, perfumes, and gasoline fumes can also trigger asthma. These irritants trigger asthma symptoms by stimulating irritant receptors in the airways. These receptors, in turn, cause the muscles surrounding the airway to constrict, resulting in an asthma attack. There are two types of asthma medicines. There's quick relief medicine, which comes in the form of a metered dose inhaler or nebulizer, and the second type is a long term controller medicine, which comes in the form of a dry powder inhaler, metered dose inhaler, pill, or nebulizer. These medicines have two very different functions. Quick relief medicines help relieve bronchoconstriction during an asthma episode. All students with asthma should have access to quick relief medicine at all times, and it should work within 10 to 15 minutes of use. Long term controller medicines prevent production of the inflammation and excess mucus in the airways. It is unlikely you'll see this medicine at school. For those students who are prescribed this type of medication, it is typically used daily. These medicines are helpful in preventing symptoms, but are not used to relieve symptoms like quick relief medicines are. Well controlled asthma requires teamwork. Communication between school staff, students, parents, and doctors is imperative. As staff, work with parents to become more knowledgeable about your students' asthma. Three main ways to ensure that someone's asthma is under control is that they're able to participate fully in activities, they are not missing school because of symptoms, and they have fewer or no urgent care visits or hospitalizations for asthma. One document that can assist in this communication is the Asthma Action Plan, or AAP. Everyone with asthma should have an AAP or care plan, and it should be completed by their healthcare provider. Everyone's warning signs can differ, and the progression of asthma symptoms is not always linear. Early warning signs of an asthma episode are shortness of breath, cough, feeling tired or weak, itchy chin or throat, watery eyes, dark circles under their eyes, or stomach ache. A stomach ache is listed because some students may be unable to identify that they're having trouble breathing as opposed to a stomach ache. In response to these early warning signs, staff should assess the student for any asthma symptoms. They should notify the health office, and then they should give or assist with giving quick relief medication per the student's AAP. If the student has no quick relief medication, call 911 immediately, and then stay with the student and observe for improvement. More serious asthma warning signs can be that medications are not working or are not lasting, wheezing, increasing in coughing or tightness in chest, or the inability to do their usual activities. Similarly to early warning signs, staff should notify the health office of the student's condition. If not already given, give or assist with giving prescribed quick relief medication as authorized by the AAP. Repeat quick relief medication every 10 to 20 minutes or as authorized in the AAP until help arrives or the student's breathing improves. If no improvement within 10 minutes of administering quick relief medication, or if the student's condition worsens at any time, call 911 immediately and then continue to monitor the student until more help arrives. Severe asthma warning signs are severe shortness of breath, difficulty walking or talking, retractions, which is sucking in skin at the ribs or neck area, and blue or gray lips and nail beds. If a student has any one or more of these severe asthma symptoms, do the following in this particular order. Call 911 immediately. Then notify the health office if they are not already present. Call the parent or guardian to let them know that their student is having a severe asthma attack, and then give or assist with prescribed asthma quick relief medication as authorized by the AAP. Stay with the student and observe for improvement. Students are allowed to carry and self administer their own asthma medication as long as certain documentation is provided. This documentation includes a parent request for self carry and administration of asthma medication form, and a copy of the asthma inhaler prescription and original asthma inhaler box or container. A doctor's signature is not required. Asthma medication should be accessible and never locked up or out of reach of the student while present. As a reminder, the asthma medication you will see in schools should be the quick relief medication as opposed to long term controllers. Another common chronic health condition that relates to allergens is anaphylaxis. Anaphylaxis is a severe, possibly even life threatening reaction to an allergen. The most common causes of anaphylaxis include peanuts, shellfish, and insects such as bee or wasp stings. Other causes include medications, exercise, and latex. A reaction to any of those allergens that causes anaphylaxis need to be addressed as quickly as possible as it can become life-threatening. As the allergen enters the blood system, the body reacts and releases chemicals that can affect many body systems. Often, allergic reactions will appear visibly on the skin in the form of hives and welts on the face, the arms, the hands, and the chest. Swelling of the lips, throat, tongue, and around the eyes may also occur. The face may become flushed, and the student might complain of itching skin and mouth. Allergic reactions also affect the respiratory system, with difficulty breathing or swallowing. The student may complain of metallic taste in their mouth, and they may experience swelling of the throat. The cardiovascular system responds by increasing the heart rate, lowering the blood pressure, and often paleness will result. Some allergens cause gastrointestinal distress, such as abdominal cramping, nausea, and vomiting and diarrhea. Nervous system involvement includes weakness, anxiety, a sense of doom, and a collapse or loss of consciousness. Each allergic reaction can be different from the previous one. The same person may react mildly during their first exposure, but the reaction can become progressively worse or can change upon repeated exposures. Some reactions are mild or local, such as a localized redness and swelling from a bee sting. Other reactions are systemic, which means they affect the entire body, causing anaphylactic response, as we have just discussed. Some reactions occur several hours after exposure. This is called a latent reaction, and students should be monitored after an exposure to an allergen. There's no cure for allergic reactions, just avoidance and precautions. Students with asthma and nut allergies are at risk for severe anaphylactic reactions. Even trace amounts of an allergen can cause reactions. Epinephrine or adrenaline should be administered immediately to students having signs and symptoms of anaphylaxis. The injection is usually given in the outer thigh and can be administered through clothing. Emergency procedures related to a student with allergies can be found in a student's food allergy care plan. A student's food allergy care plan gives the school staff information about what food or foods the student is allergic to, the signs and symptoms the student may present if an allergic reaction is occurring, and specific emergency treatment information, including the use of emergency epinephrine. This information is confidential health information. For the administration of epinephrine, specific directions are on the package and should be followed. They are simple and easy to use. 911 must be called, and the student must go to the nearest emergency room for an evaluation. An additional emergency injection may be needed 10 to 15 minutes after the initial one if symptoms do not improve. The student should lie down if they are feeling faint or dizzy. The student should never be left alone at any time, and when emergency responders arrive, give them the used injection along with the time that it was administered. Classrooms which have an allergic student need to be aware of what food allergies the students may have and take precautions to avoid exposure. Your school nurse will keep you informed. Students in such classrooms need to have in place a hand washing program. After eating, students should wash their hands to remove any food residue that may come in contact with the allergic student and potentially cause an allergic reaction. To keep the classroom safe, an approved snack list is provided to families each year. In accordance with the District 44 Wellness and Food Allergy Policy, only the foods on this list may be brought to school for a snack in the classroom. There are many students in the building with severe food allergies, and because of this, snacks cannot be shared with other students. Snacks that are made in a plant where peanuts and/or nuts are processed are not allowed in the classroom. School staff should use caution when planning outdoor activities or field trips to prevent inadvertent exposure of allergens, which are proteins in the air such as peanut dust. Teachers should be aware that using foods as part of a lesson plan can be dangerous to a student with a food allergy. Even if the food is not ingested, contact or inhalation of the food protein could be dangerous. Food service staff and lunch supervisors should be aware of students' food allergies as well and follow recommended procedures in the event a student has an allergic reaction or exposure to an allergen. Shifting from asthma and allergies, we'll now focus on diabetes. Diabetes is a chronic health condition in which the body does not produce insulin or produces inadequate insulin. Diabetic students can have incidents of both hyperglycemia, which is high blood sugar, and hypoglycemia, which is low blood sugar. Hypoglycemia, or low blood sugar, can be caused by too much insulin, skipping meals or delaying meals or snacks, too much exercise, or unscheduled exercise. Hyperglycemia, or high blood sugar, can be caused by illness, too much intake of carbohydrates, or missed insulin. The signs of hypoglycemia or low blood sugar include shaking, sweating, a fast heartbeat, hunger and weakness, headaches, dizziness, blurred vision, irritability, confusion, and anxiousness. The signs of hyperglycemia or high blood sugar include thirst, hunger, frequent urination, weakness, fatigue, irritability, blurred vision, slow healing of wounds, frequent infections, and unexplained weight loss. Most importantly, when it comes to diabetes, the school staff should follow the student's diabetes care plan. When hypoglycemia or low blood sugar is expected, the student should be escorted to the health office to have blood sugar tested and for appropriate treatment. If unable to get the student to the office, try to give the student 15 grams of carbohydrates. This could include 4 ounces of fruit juice, 4 ounces of regular soda, 3 to 5 glucose tablets, 3 packages of sugar, or 1 to 2 tablespoons of cake icing. When in doubt as to whether or not the student is hypo or hyperglycemic, always treat as if the blood sugar is low. Hypoglycemia or low blood sugar can become life threatening very quickly. When hyperglycemia or high blood sugar occurs, the student will require insulin. The student should always be escorted to the health office. There, the student's blood sugar will be tested and the appropriate treatment given. In a diabetic emergency, if a student loses consciousness, has a seizure, or cannot swallow, you will need to do the following procedures. In a diabetic emergency, always assume that the blood sugar is low. Hypoglycemia can become life threatening very quickly. In a diabetic emergency, call 911 immediately. Medical staff and CPR trained staff should be notified as well. The student's parents should be notified. The school nurse or trained staff should give a glucagon injection. When the EMTs arrive at your school, direct them to the student. Never give an unconscious student or a student having convulsions anything by mouth. Always stay with the student until help arrives. There are steps you can take before an emergency happens. The first is being familiar with the student's emergency health care plan. Next, you should understand how to identify when a student may need immediate medical care. And last, know who to contact in the event of an emergency. The final chronic health condition we will examine are seizures. This training is an introduction to basic seizure types you may see in the classroom, adapted from a training provided by the Epilepsy Foundation of Greater Chicago. It will cover first aid and highlight the seizure action plan. A seizure is commonly referred to as an electrical storm in the brain. But what does that really mean? To help understand this further and how it affects the brain, it is helpful to think how cell phones work and apply that analogy to the brain. Cell phones use electrical signals to transmit information. If there are too many signals in an area, sometimes messages are blocked, delayed, or undelivered. In the brain, we have millions of neurons that are also transmitting electrical signals, directing information from our brain to our body. If there are too many signals or the neurons crossfire, a seizure can occur. That seizure can cause a person to have a change in their movement, behavior, awareness, or senses. There are more than 20 types of seizures, and today we will focus on several common types you may see in the school setting. Seizure characteristics will be stereotypical. You are looking for like or similar symptoms every time. This means that when a student in your classroom presents a symptom, such as smelling oranges as an example, he or she will always experience that symptom. This information should be provided on their seizure action plan, which your nurse has. Seizures always have phases. The prodromal phase of a seizure can be hours before or days before a seizure actually begins. You may notice a change in a student's behavior. The aura is the first sign of a seizure, and not everybody has this experience. Some students describe feeling funny, having a metallic taste in their mouth, having a slight hand tremor, or having an altered sense of smell before a large seizure starts. The ictus phase is what is actually happening during the seizure. The postictal phase describes a person as they return back to baseline. Epilepsy is a central nervous system or a neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop epilepsy, and it affects both males and females of all races, ethnic backgrounds, and ages. Having one single seizure is not epilepsy, but rather it is a diagnosis of recurring unprovoked seizures. The onset of epilepsy can occur at any age. For 30% of people living with epilepsy, there are four commonly known causes: traumatic brain injury, brain tumor, stroke, and brain infections such as malaria. For 70%, the cause is unknown. Traumatic brain injury is rapidly becoming the fastest growing population of people developing epilepsy. All seizures fall into two categories: generalized and focal. The difference between these two types is how they begin. Generalized seizures begin in the whole brain and affect both hemispheres simultaneously and include muscle convulsions, staring spells, spasms, and falls. Focal seizures, previously called partial seizures, start in one part of the brain and affect the part of the body controlled by that part of the brain. Symptoms for these depend on where the seizure originates. For example, the occipital lobe, which is responsible for vision, is an area in which a seizure can originate and could cause a person to have excessive or rapid eye blinking. A generalized onset non motor seizure is a quick seizure with a brief lapse of awareness and can last from 1 to 10 seconds. It looks like daydreaming or that the student doesn't want to pay attention in class. It can occur in clusters, and no first aid is necessary here. The second type of generalized seizures is what most people associate with epilepsy and seizures in general, but it's not the most common. A generalized onset with motor symptom seizure begins with a hoarse cry or a moan, followed by loss of consciousness and a fall to the ground, whether the student is standing or sitting. The moan is simply air that is compressed from the diaphragm. The person is not in pain at all. The first phase of this seizure type is the tonic phase, and the arms and legs will stiffen. Some will stay in this phase, and others will go on to the clonic phase, which is the convulsive phase. Arms and legs and other muscles will contract. Eyelids can open and close, there may be shallow breathing and drooling, and a combination of these things creates foam at the mouth. It can be frightening to watch, but everything that happens to the person during this seizure is normal, and our job is to make sure the person is safe and not to interfere. This seizure lasts 1 to 3 minutes, and anything beyond 5 minutes becomes a medical emergency, which is called status epilepticus. Rescue medication is needed to stop a seizure at that time, and we'll discuss that later in this training. Two other generalized seizures you may see in the classroom are juvenile myoclonic seizures and atonic or drop attack seizures. With a juvenile myoclonic seizure, you may see sudden, brief muscle jerks like a shoulder shrug or a muscle spasm. No first aid is necessary here. An atonic or drop attack seizure is a quick seizure involving sudden loss of consciousness. The person will regain consciousness within a minute and resume whatever activity they were doing. Some students may wear helmets as protection. Focal seizures, which used to be referred to as partial, can present with or without motor symptoms and with or without awareness. A focal seizure originates in one part of the brain, and depending upon where it originates, the symptoms will vary. In a focal aware seizure, a person is awake, alert, and aware that they are having a seizure. For example, a person may wring their arm but is not able to control that behavior because of the way the motor cortex is controlling the action. The student may also have non motor symptoms they cannot explain, such as a sudden sense of fear or an unexpected feeling in the stomach. This is a quick seizure with a quick recovery, and no first aid is necessary here. Focal seizures are also known as auras, and some students may experience these symptoms and know that a bigger seizure may begin soon. In a focal impaired awareness seizure, a person is not aware that a seizure is occurring. It is more common in adults rather than students and begins with a blank, dazed stare, then he or she goes into repetitive, purposeless movements. It may look to bystanders that a person is confused, has behavior issues, or is under the influence of drugs. In the classroom setting, we often hear about students who wander or try to climb onto desks. Remember that with altered awareness, the person having the seizure will have no control over their seizure activity. First aid for seizures is aimed at keeping the person safe until the seizure stops on its own. First aid for convulsive seizures is very intuitive. Your main job is to ensure that the student is safe. You can do that by turning the student on his or her side, protecting their head, and removing hazards out of the way. Track the time as soon as the seizure begins and never put anything in the person's mouth. In the event you have a student having a convulsive seizure in a wheelchair, please secure the wheels, fasten the belt, and allow them to have the seizure in the chair. Protect and support their head, and you can remove them after the seizure has ended. The first aid for a focal onset with impaired awareness seizure, also known as a complex partial seizure, is also straightforward. Please make sure that you do not restrain or hold back the student if they begin wandering. You can protect them by blocking hazards such as doorways or stairs. Remember to track the time as well. 5 minutes becomes a medical emergency. Finally, it is important to know and follow the seizure action plan for appropriate emergency protocol. Most seizures will not be emergencies. However, there will be some instances in which you will have to call 911. A first time seizure, if a student had more seizures than usual or a different type of seizure, if the student got injured during the seizure, if a convulsive seizure lasted more than 5 minutes, if the seizure ends and another begins right away, and finally, if the seizure action plan instructs you to call 911. Doctors generally begin by treating epilepsy with medication. If medications don't treat the condition, doctors may propose surgery or another type of treatment. Most people with epilepsy can become seizure free by taking one anti seizure medication called anti epileptic medication. Others may be able to decrease the frequency and intensity of their seizures by taking a combination of medications. Be sure to know if there are any side effects from the medication your students are taking. Sometimes the unwanted side effects of medication preclude people from taking it in the first place. Common side effects are forgetfulness, tingling in the fingers, weight gain, and weight loss. With so many options for treatment, surgery for epilepsy is no longer considered a last resort. Epilepsy surgery may be able to offer relief when medications either cannot control seizures or cause unmanageable side effects. For the 30% of people living with epilepsy, in which case medication does not work, some other options are a vagus nerve stimulator, in which a VNS is surgically implanted into the left chest and it's connected to the vagus nerve, or a responsive neural simulator that is surgically implanted under the skull and electrodes are inserted right at the seizure site. Surgery resection or laser ablation is also an option if the person is a candidate. Finally, dietary therapy is a growing option, especially for families of younger children. The ketogenic diet, or keto, has been found to work well in difficult to treat seizures by eliminating all sugar and maintaining a high fat and protein content. Diastat or Nizolum are medication used to treat episodes of increased seizures in people who are already taking medications to control seizures. These products are only recommended for short term treatment of seizure attacks and are not for ongoing daily use to prevent seizures. In order to be best prepared for a seizure of any type in the classroom, we highly recommend that a seizure action plan be completed by the family and submitted to the school. It should highlight all of the seizure information, including symptoms and times to call 911 for an emergency. Contact information should be listed and it should be signed by the treating physician. This form is available on our health office website and attached to this module. This concludes our training on chronic health conditions. If you have any questions about the conditions discussed or other chronic health conditions, please don't hesitate to reach out to the Special Services Department, your building nurse, or your building principal. Thank you.